Welcome to the Buzz on Bioidenticals program, Achieving Hot Flash Relief for Women with Chronic Conditions. In this section, we will provide information on heart health. As we all know, an increasing number of women have high cholesterol and are taking statins or drugs to reduce their cholesterol. Dr. Stryker, can these women safely take transdermal hormone menopausal therapy?
This is a really important point because so many women do take statins to reduce cholesterol. One of the criticisms of the WHI study is that when the results were first reported, they didn't separate women who were taking statins from women who were not. A closer look showed that women who took statins did not have the same cardiovascular events that the group as a whole had. And since that information wasn't in the initial report, there's still a lot of doctors who aren't aware that the women taking statins had much better outcomes. Having a high cholesterol is one of the big risk factors for developing heart disease, which is why doctors routinely check blood cholesterol levels and often recommend statin medicine if someone's levels are dangerously high. But the total cholesterol is only part of the story. Cholesterol is made up of HDL, also known as the good cholesterol, think H for happy, you want that one to be high, and LDL, the bad cholesterol, think of that one as the lousy cholesterol, that's the one that you want to be low. And all estrogens reduce cholesterol. In fact, years ago, some cardiologists prescribed estrogen to patients to reduce their cholesterol levels. But then there's the triglycerides. Triglycerides are part of the total lipid picture, but they're different from LDL and HDL cholesterol. And in fact, you can have a normal cholesterol and very high triglycerides. We know that triglycerides are an important risk factor for cardiovascular disease and blood clots. Oral estrogens increase triglyceride levels, which is one of the reasons there was an increase in blood clots in the WHI study. Transdermal estrogens not only don't increase triglycerides, they actually lower someone's triglyceride levels. So it's not enough to know your cholesterol level. You also need to know your triglyceride level when you're making a choice about estrogen therapy.